All right, as we progress through our first generation NSAIDs, we're going to look at diclofenac sodium, which is Voltaren. It's given PO, and its action is to inhibit the synthesis of prostaglandins or block the synthesis of prostaglandins. It's actually used with arthritis bursitis, sprains, dysmenorrhea, headaches. Side effects are your tinnitus, dyspepsia, and bleeding time that's prolonged. So you see the commonalities again in this with your first generation NSAID. Ketorolac, which is also called Toradol, is given POIM or IV. It is actually the first injectable NSAID. So with that, that is something that stands out. First injectable NSAID. Its action is anti-inflammatory and analgesic. Its use is in the postoperative pain management, which we see postoperatively, usually within the first 2 or 3 days. They will give Toradol around the clock to decrease the inflammation from the surgical procedure, because we know the inflammatory response occurs with surgery. And that decrease in inflammation is going to help with the pain postoperatively. So it's in the postoperative pain management. It also helps in the postpartum pain management, which is the inflammatory response from giving birth. The side effects of it is GI pain and hemorrhage and prolonged bleeding time. And if you pull out your Davis Drug Guide, you can actually look up under the Davis Drug Guide, under the Ketorolac, and you will find that there's certain parameters that you need to follow as far as dosing the individual on Toradol. For Toradol, it is dose dependent on age and renal impairment. If they are greater than 65 years of age and they have renal impairment, so we're going to look at their BUN and creatinine, the dose is actually cut in half from the normal dose. So just remember, with Toradol, it is dose dependent upon their age and their renal impairment. There's also in your Davis Drug Guide, if you read a little bit further under the indications, you'll find out that there's a total number of days that you should not exceed the administration of Toradol, and that would be 5 days. After 5 days, you should stop Toradol because of the increased potential of prolonged bleeding time. So truly, Toradol is only recommended for the short-term pain management. So the things that stood out with Toradol: first injectable NSAID, and it's used in the immediate post-op period to decrease the inflammatory response, help with the pain management, and it's dose dependent on age and renal impairment, and it has a limitation. We can only give it for 5 days. After that 5 days, we should stop it because of the increased prolonged bleeding time. Ibuprofen is another first generation NSAID, and I really don't need to talk a lot about that because we're all familiar with ibuprofen or Motrin. It's given PO. It inhibits the prostaglandins, again, antipyretic, analgesic. Used for the arthritis. It's also used for dysmenorrhea, which is painful menstruation, and the reduction of fever. The side effects of Motrin would be dizziness. It can lead into acute renal failure, increased blood pressure, toxic hepatitis, and GI bleeding with fluid retention. The nursing interventions with Motrin would be that we don't want them to take Motrin plus aspirin. That's 2 first generation NSAIDs. That's only going to potentiate the effects of the bleeding time. They need to avoid alcohol while taking Motrin. And we advise pregnant women to avoid NSAIDs, okay? During their pregnant period, they should not be taking NSAIDs. We only advise them for Tylenol, and that's because of the potential for congenital abnormalities as well as hemorrhage in that postpartum period. Feverview, garlic, ginger, ginkgo, and Dong Quai, if taken in conjunction with Motrin, can actually cause bleeding if used with the NSAIDs. Naproxen or naproxen, we also have heard it as Aleve, is given PO, analgesic, anti-inflammatory, antipyretic, for arthritis, dysmenorrhea, mild, moderate pain, and the side effects are common: headache, drowsiness, dizziness, GI bleed, and tinnitus. Meloxicam is Mobic. Mobic is a PO form, anti-inflammatory, analgesic, antipyretic, used for arthritis, and side effects: abdominal pain and dyspepsia. So we've just completed our first generation, and just to recap the commonalities, okay, it's going to block the COX-1 and COX-2. If you know that, then you can understand what kind of potential side effects that you will actually see with that. The earliest one is aspirin back in 1899, and if it blocks the COX-1, that means you're going to have more bleeding, okay, less clotting. If it blocks the COX-2, you're going to have a reduction in pain and inflammation. Aspirin stood out because it helps treat with TIAs and MIs. The commonalities that we found as far as the common side effects would be dizziness, headache, tinnitus, GI ulceration, dyspepsia, and bleeding. Common actions that we see it used for is antipyretics, anti-inflammatory, and the inhibition formation of the prostaglandins, which actually leads to a decrease in pain. The common uses is our itises. We saw arthritis, bursitis, tendinitis. We did see some dysmenorrhea here or there. Toradol, which stood out as the first NSAID injectable. It stood out in the aspect that it is dose dependent on age greater than 65 and renal impairment. We actually cut the dose in half, and it only has a total number of days of 5 before we stop it. So it's only required in our short-term management there. So I think that kind of recaps most everything. I didn't go over Indocin. The one that stood out with that was the closure of the patent ductus arteriosus. So we've just completed first generation, and we've pulled out the commonalities. So how do you learn from here is you actually say, I have one heading, it's first generation. What falls under that heading? And that would be Clinaril, okay? It would be Mobic, it would be Oxycam, it would be Toradol, Voltaren. You have to list all the common first generations. So you're going to think first generations, they block COX-1, COX-2. These are my common first generations, and you're going to list them. And then to the side, you're going to say, okay, this is what stands out with this one, this is what stands out with this one, and this is what they all have in common. So that's how you should approach your study habits with pharmacology. Next, we're going to go into our second generation NSAIDs. And remember, these only block COX-2. So COX-1 enzyme is still released from the cell, which means our stomach lining is protected, and we help decrease the pain and inflammation. So second generations are the drug of choice for patients with severe arthritic conditions. You know, we did see some itises in the first generation, but the second generation is more severe, and they need higher doses of the anti-inflammatory drugs. So I'm only going to really give you one COX-2 second generation inhibitor, and that's going to be Celebrex, which is the most common. Celebrex is given PO. Its action is to inhibit the COX-2, but not the COX-1. So we're blocking the COX-2, so that helps with pain and inflammation. We're not blocking the COX-1, and that means our stomach lining is protected. Use for severe arthritis, and we can also use it for severe dysmenorrhea. Side effects: headache, dizziness, nausea, flatulence, rash, peripheral edema. All right, so we have covered first generation, second generations in broad headings. Well, while we're under inflammation, I do want to touch briefly on corticosteroids. Corticosteroids is another big heading that I want you to place these medications in.